Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome to my channel. Today I'm going to talk about personality disorders, and as we all know, I make health and healthcare videos explaining you complex medical terminology in a very simplified language, and all my information is from a very authentic, internationally accepted US National Medical Library. So today I'm going to talk about personality disorders in general, and I'm going to stress on borderline personality disorder for specifics. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Guys, personality disorder is a group of mental illness which involve long-term patterns of thoughts and behaviors that are unhealthy and inflexible. Inflexible meaning they cannot change for that person. He is unable to change, and it's unhealthy for himself or for the people living around him. These behaviors can therefore cause serious problems in their relationships or work. People with such personality disorders will obviously have troubles dealing with everyday stress and problems. So therefore, they often have stormy relationships with other people. There are many types of personality disorders like antisocial, avoidant personality, borderline dependent personality, histotonic, narcissistic, obsessive compulsive, paranoid personality, schizoid, schizotypical, schizophrenic. So there are so many types of personality disorders. We're going to cover some of them, the most common of them and the most interesting of them. So today I'm going to talk about borderline personality disorder. This is from a recent request from a friend. Borderline personality disorder is a mental illness where the person will show ongoing patterns of varying moods. The moods will vary, his self-image will vary, and his behavior will vary. He will therefore often have impulsive actions and therefore problems in relationships. People with these kind of borderline personality disorder experience intensive episodes of anger, sometimes depression, sometimes anxiety, and these things can last from a few hours to a few days. Now let's take a look at what signs and symptoms will you see in a person with these kind of disorders. See, people with such borderline personality disorder experience mood swings. They will display uncertainty about how they see themselves and their role in the world. As a result, obviously, their interests and values will change very quickly. And they tend to see things in their extremes. That means all is good or all is bad. So everyone is bad, this is also bad, he must be having a bad intention, no, everything is good, he must be having a good intention behind it or something like that. So their opinions of other people can also change very quickly. So they might find an individual as a friend one day and may consider him or her as an enemy or a traitor the next day. These kind of shifting feelings can actually lead to intense and unstable relationships. This is the first sign: unstable, intense relationship, imbalance in thinking and feelings. What are the other signs? These people will show efforts to avoid abandonment, no matter if it is real or imaginary. They don't want to be abandoned. They don't want to be left alone. So if you are in a relationship, they might show a very rapid initiation of intimate relationship, or sometimes even cut off communication with the other person in anticipation of being abandoned. So they have a fear of abandonment. These people also show a pattern of intense and unstable relationship with their families, friends, loved ones. And often they swing from an extreme closeness and love, like an idealization image to an extreme dislike, anger, or devaluation behavior, sometimes within the same day. These people might also have a distorted self-image. They might show signs of impulsive and often dangerous behavior, such as they might go out for a spending spree, they might go into substance abuse, reckless driving, binge eating, unsafe sex. And these behaviors occur primarily during a period of elevated mood of energy. And mind well, these behaviors can also be a sign of mood disorders, which is not borderline personality disorder, it's different from that. So these symptoms can happen. Then they might have self-harming behaviors such as cutting as well, cutting their wrist, cutting their body. Then they might even have recurrent suicidal behaviors or even threats. Intense and highly changeable moods, with each episode lasting from few hours to few days, chronic feeling of emptiness, inappropriate, intense anger, problem controlling their anger, difficulty trusting people, sometimes with irrational fear of other people's intentions, feeling of dissociation such as feeling cut off from oneself or seeing oneself from outside one's body, or feeling of unreality can also be seen. But make a note, not everyone with borderline personality disorder experience every single symptom. Some individuals experience only a few symptoms while others may have many. Symptoms can be triggered by seemingly ordinary events also in such patients. For example, people with borderline personality disorder may become angry or distressed over a minor separation from people to whom they feel close, such as traveling on a bus trip. They might just become angry or distressed because of that. The severity and frequency of these symptoms and how long they will last, they vary greatly depending upon the individual and their illnesses. So, what is the basic reason for borderline personality disorder? The reason is unknown, the cause is unknown. The cause for personality disorder altogether is unknown, but there are certain risk factors, there are genetics, family and social factors which are thought to play roles. And the risk factors for borderline personality disorders are a disrupted family life, poor communication in the family, sexual, physical or emotional abuse, or abandonment in childhood or adolescence, either real or an imaginary, or even the fear of abandonment can lead to borderline personality disorders. So a lot of things play a role here. Even the brain structure and function, your environment, your culture, social factors play a role, and these all increase your risk of developing borderline personality disorder. Now, how do you diagnose? What are the tests and exams? A licensed mental health professional such as a psychiatrist, a psychologist, or a clinical social worker experienced in diagnosing and treating mental disorders can diagnose borderline personality disorder by they can do a complete and thorough interview of the patient, discussing the symptoms as well as the family histories, including history of mental illnesses, performing a careful and thorough medical examination, ruling out possibilities of other symptoms. Remember, borderline personality disorders often occur with other mental illnesses as well. Co-occurring disorders can make it hard to diagnose and even treat, especially if the symptoms of other illness overlap with the symptom of borderline personality disorder. For example, a person with borderline personality disorder may be more likely to also experience symptoms of depression, bipolar disorder, anxiety disorder, substance abuse disorder, or even eating disorders. So you might be treating them but forgetting about borderline. Lastly, psychotherapy. Psychotherapy is the first line treatment for people with borderline personality disorder. A therapist can provide one-on-one treatment between the therapist and the patient, or treatment can be done in group settings. The therapist leads these group sessions, which helps teach these people with borderline personality disorder how to interact with others and how to effectively express themselves. It is very important for these people in the therapy to get along and trust their therapist. The very nature of a borderline personality disorder person can make it difficult for people to maintain a comfortable and trusting bond with their therapist. So it's little tricky here, but therapist will take care of that. The two examples of psychotherapies used to treat borderline personality disorders include dialectical behavioral therapy, DBT. This type of therapy was developed for individuals with borderline personality disorder using concepts of mindfulness and acceptance, or being aware of and attentive to the current situation or emotional state. Meaning, we try to give the patient insight so that he knows what kind of behavior he is doing, accepting that he has behavioral problem, accepting his current emotional state, and therefore changing his behavioral pattern. He can actually control intense emotions, reduce self-destructive behaviors, and improve relationships if he can control this, have an insight in his own thoughts. The second is cognitive behavioral therapy. This therapy can help people with borderline disorders identify and change their core beliefs and even behaviors. These core beliefs and behaviors are those which actually are the problem why they have issues interacting with others. So cognitive behavioral therapy, they help reduce a range of mood and anxiety symptoms, reduce the number of suicidal or self-harming behaviors as well. So various such type of psychotherapies exist in transference focused psychotherapy, schema focused psychotherapy, and then dynamic deconstructive therapy, mentalization based therapy, and even supportive psychotherapy. I'm not a specialist of psychotherapy or psychology, so I'm just explaining you something which I have studied for the purpose of this video. So don't start asking me a lot of questions about this. The best person to ask these questions is a psychologist or a psychiatrist. So that's all about borderline personality disorders. If you ask me what is the prognosis of such patients, the outlook of the treatment depends upon how severe the condition is, whether the person is willing to accept help or not, and with long-term psychotherapy, talk therapy, the person often gradually improves. But there are chances of complications, including depression, drug abuse, problems with work, family, social relationships, and even suicidal attempts and actual suicides. So therefore, a doctor, a medical professional should be in the loop along with the family and the patient. So I hope this video gives you an outlook into borderline personality disorders, and for further information about these diseases you can go online, look into the US National Library of Medicine and study the subject yourself, and you can contact a psychologist or psychotherapist for any further needs if you have. And I hope to make further videos, not so detailed but brief videos about other types of personality disorders as well. Next I'll cover OCDs, narcissistic disorders. So don't forget to watch those videos. Those who don't know me, I am Dr. Paramjeet, consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and this is my channel, and I make videos about health and healthcare topics. A lot of videos are already made, and videos are present in both English and Hindi language, so watch videos as per your preference. Watch both if you like them, because sometimes I'm better in Hindi, sometimes I'm better in English. So go ahead, watch both versions if you understand both languages, and don't forget to share these videos with your friends and family and promote my channel, because if you like these videos, maybe your friends will do, because good things are worth spreading. So till next time, I'm Dr. Paramjeet. Keep watching my channel. Stay collected, stay healthy. People with such personality disorders will and often swinging the off, and these people often swing, and these people, but that may occur with this problem, with this disease, with this disorder, their family mental, and remember, dynamic, destructive. I cannot guide you. Forget about this. Maybe your friends will also. Maybe your friends won't. Maybe your friends will also like the video. Stay connected. Borderline personality. If you see, borderline personality disorder is marked by ongoing pattern. Borderline personality disorder is a mental illness where the person will show an ongoing pattern. Borderline personality disorder is a mental illness where the person will show